I think it's fair to say most Australians, and certainly those in this room, are aware of what's happening in primary care, the linchpin of the Australian health system that has general practitioners at its very centre.
In some places, particularly rural and regional Australia, forget finding a bulk billing doctor, you struggle to find a doctor at all. All this puts real pressure on our hospitals because too many conditions are going untreated and become increasingly serious. The case for reform I think everyone accepts now is urgent. We can't keep trying to treat 21st century Australia with our 1980s Medicare.
Health leaders, hospitals, primary care providers and academia all echo similar fears that our healthcare system is strained and in danger of cracking under the pressure of an ageing population and increase in chronic disease.
Australia is absolutely facing a major health crisis at the moment. It's been years in the making and we're finally seeing it bear fruit, and it's absolutely critical that as a society we understand it and that we do everything we can to prevent it getting any worse. It's our responsibility as a profession and as a country to do this.
Professor Robson is focused on that responsibility to provide a sustainable future healthcare workforce, but with a massive hurdle to overcome. GPs take 10 years to train, and current data points to a shortfall of 10,000 general practitioners in this country by the end of this decade.
And that's potentially catastrophic because GPs are the bedrock of healthcare in this country. And in fact, they're also the most efficient part of our health system. So we need to do everything we can to make sure it is a thriving destination for newly graduated doctors.
There have been some unintended consequences of the funding models that we've adopted that have meant that we've disinvested in some of the breadth of GP skills, and that's probably also meant that it's a less attractive proposition to go into. But now's the time to really invest more and look at what are the different models we can use and adapt. We have a reasonable spend on healthcare research. We spend very little on health systems research, and there's been a whole lot of barriers to really trying to do high quality research into what are the models of healthcare systems that are more effective.
The National Centre for Health Workforce Studies, established in 2022, is confronting that urgency and looking at the form policy interventions should take.
It brings together experienced researchers and national experts to attempt to address some of the workforce challenges that we're currently facing. The health and care sector accounts for the largest segment of the labour force at 15%, and it contributes to 10% of the gross domestic product. We need to make sure that we've got the right people with the right skills in the right place at the right time.
And at the Australian National University, the policy, research, education and training settings required to address these long-standing challenges are being rethought.
The Australian National University has a unique position as the Commonwealth Government's university, situated in the nation's capital, with expertise and access to data and information that is incredibly important to guiding the future of healthcare in this country.
It's widely accepted that a value-based approach to funding a sustainable healthcare system and workforce into the future starts with primary care.
We know that those healthcare systems with strong primary healthcare offer better health outcomes, better patient satisfaction, and at a lower cost than those that are primarily hospital-based.
Maldistribution of GP resources, particularly in rural and remote areas, is a major challenge to be overcome.
The 1 in 4 Australians who live outside of our major centres, access to healthcare can be extremely difficult, and this plays out in multiple ways. It can be difficult to have a baby, it can be difficult to get mental health care, it can be very, very difficult to have care of acute conditions.
At the Australian National University, the focus is on wrapping interrelated health services around patients. Professor Paul Fitzgerald heads Australia's first ever combined School of Medicine and Psychology.
Programs that we are developing are clearly informed by the recent pandemic. This clearly demonstrated the absolute interrelationship between body and mind and the social factors that influence how people engage with and take advantage of healthcare systems. And so if we don't take those learnings forward, we're really missing a unique and very important opportunity. You know, the healthcare system is going to change more dramatically in the next 10 or 20 years than it has probably in the last 50 years. Medical education has recruited and trained doctors in relatively traditional ways to function within the system as it currently stands. And that doesn't necessarily lead to developing individuals who are going to be best placed in an environment where change is so dramatic, which I think it is highly likely to be.
Really long-term epochal changes in some ways. Paradigm shifts, going from solo practitioner, small practice care to team-based care, going from evidence-based medicine based on the average patient to much more precision types of treatment based on higher-end diagnostic information and targeted treatments tailored to the individual. These create opportunities for new models of healthcare. And so that's an exciting part of a transition. It's not just about crisis, it's about shaping the healthcare system for the future.